Order. I call this meeting to order. This is the Standing Committee on Community Services. My name is Susan Corkum-Greek. I'm the MLA for Lunenburg and chair of this committee. I'd like to welcome presenters today as we explore the topic of guaranteed basic income. Reminder to everyone to please switch your cell phones to silent, and that in the case of an emergency, we would use the Granville Street exit and walk up to the Grand Parade. We'll now ask committee members to please introduce themselves for the record by stating their name and their constituency, and we'll begin on my left.
Good morning, Tim Outfit, MLA for Bedford Basin. He, him, Tim, you can call me.
I like that. Good morning, everyone. My name is Adigoke, MLA for Clayton Park West.
Good morning, Tory Rushton, MLA Cumberland South.
Good morning, Kyle McQuarrie, MLA Inverness.
Ian Rankin, Timberley Prospect.
Good morning, Lena Hamid, MLA for Fairview Clayton Park.
Good morning, everyone. Susie Hanson, MLA for Halifax Needham.
Thank you all, and I would like also to note the presence of Legislative Counsel Aaron Fowler and our Legislative Committee Clerk, Tamer Nusaba. So again, the topic today is guaranteed basic income. We will welcome our witnesses. I will ask our witnesses to please introduce themselves, after which we will move into opening remarks. But if we can begin on my left.
Good morning. My name is Frazer Egerton. I am an Executive Director of Strategic Operations and Innovation at Opportunities and Social Development.
Good morning. Craig Beaton, Deputy Minister, Department of Opportunities and Social Development.
Good morning. My name's Elizabeth K. Rainingberg, but you can call me Mandy, my nickname, and I'm the Chair of Basic Income Nova Scotia.
Good morning. I'm Pierre Stevens, Treasurer of Basic Income Nova Scotia.
Again, thank you all for being here this morning. In terms of opening remarks, I believe we're going to begin with Deputy Beaton, please.
Good morning, and thank you for the opportunity to be here today. As we previously introduced, joined by my colleague Frazer Egerton here to speak to you about poverty, affordability, and how government supports those who need help. This is a timely discussion. There are issues on the minds of many Nova Scotians. Poverty is complex. It's influenced by many factors: intergenerational, structural, historical, but also individual circumstances. Depending on the size or makeup of your household, where you live, your health status, your ability to work, your needs will be different, which is why we need flexible solutions, a set of supports that are responsive, targeted, and connected. The tools we have in our toolbox are things like income assistance, which has increased 3 times in the last number of years, and will increase again this January in line with Consumer Price Index. Disability support, not only from our traditional funding programs, but also with new disability supplement, which provides an extra $318 per month to over 15,000 income assistance recipients living with disabilities. The PATH program, which provides targeted financial support and community connections to young people leaving care right up until their 25th birthday. Supportive housing, which includes things like the Rose for families or children, with families and children, and the Ozanam Place for people over 50 with complex healthcare needs. Our staff also draw upon programs and services in other departments, like rent supplements, heating assistance rebates, and childcare supplements. Government has also implemented affordability measures more broadly to support Nova Scotians: lower taxes, increased minimum wage, and the school lunch program, to name a few. While some programs provide financial assistance, many others focus on removing barriers, creating opportunities, and helping people build long-term stability. That's why our caseworkers and care coordinators and social workers do every single day. They work directly with Nova Scotians in communities across the province to understand the unique circumstances to create the right mix of supports at the right time. It's a one-size-fits-one approach, and it evolves and changes along with our clients. With respect that there are other models out there like guaranteed basic income, which is the topic of today's discussion, That's an approach. We respect, that there's models out there like guaranteed basic income, which is the topic of today's discussion. That's an approach we have looked at, and we will continue to look at it when new evidence emerges. But it's not something that we're considering right now. We all want the same thing at the end of the day, to support all Nova Scotians to live with dignity, provide for themselves and their families, and have the same access and opportunities as everyone else. We will continue to advance that mandate with targeted, evidence-informed programs that make a real difference in people's lives. Thank you again for the opportunity to be here, and we look forward to your questions.
Thank you, Deputy. Are there additional opening remarks from the department? Okay, I will recognize Mandy. Did you say that may be too informal, although it sounds lovely? Ms. Raining-Bird, if you would like to make your presentation.
Okay, thank you very much for having us today. We really appreciate this opportunity and look forward to the discussion after my presentation. Can you see it?
Not yet.
Okay, there you go. Okay. So I first want to talk about why it's important for us to have a basic income guarantee or guaranteed basic income. Both are okay ways to address this topic. We need a basic income because too many people in Nova Scotia today are suffering. Poverty rates, food insecurity, and food bank use are all rising. Housing prices are out of reach for many, and non-market housing levels are far too low. Many can only find precarious work that's temporary or part-time, and household debt is at an all-time high. And all of this, while we're dealing with economic uncertainties created by tariff wars, environmental degradation, and climate crises like the last 2 years and the fires that we've had here in Nova Scotia. And who are the most vulnerable? The traditionally marginalized, such as Indigenous people, African Nova Scotians, the disabled, and perhaps surprisingly, single adults between the ages of 18 and 64. And of course, we are all aware, despite the efforts of governments, that income assistance rates in Nova Scotia are low. And these are the current income assistance rates. And they're enhanced to some extent by, for various households, by additional federal and provincial benefits and tax credits, as shown in this table. But these are not sufficient to raise people who have no other income out of deep poverty, as the gray lines indicate, for various households in Nova Scotia. And as these figures show, despite the efforts of government, these people are not rising above deep poverty levels over time. So income supports in Nova Scotia are insufficient. They're also difficult to navigate because of the complex system that exists, and the various pockets of money that exist that need to be applied for. There's what many people find to be demeaning rules and oversight. Because of the clawback rates, it often disincentivizes work and keeps people in poverty. I want you also to consider some of these other issues that support the implementation of a basic income. We know poverty rates, as I just mentioned, are high in Nova Scotia, and as Conservative Senator Hugh Segal said, the late Conservative Senator Hugh Segal said, poverty is the best predictor of early illness and early hospitalizations, longer hospital stays, and earlier death. It is a reliable predictor of substance abuse, food insecurity, poor education outcomes, and for some, trouble with the law. These issues that are brought on by poverty cost this province a lot of money. One study has shown that the Atlantic provinces spend about $4.5 billion a year on poverty costs. And for Nova Scotia specifically, it's about $2 billion a year in costs related to these difficulties that poverty causes. There's other reasons for supporting a basic income. Canada, for example, has signed the UN Sustainable Development Goals, and in signing that, we as a country have pledged the unequivocal commitment to eradicate poverty. We're not doing that. We're not doing that yet. The final report of the Missing and Murdered Indigenous Women and Girls had two calls for action. One of them was to establish two basic income calls for action. One was to establish a guaranteed annual livable income for all Canadians, including Indigenous people. The most current report of the National Advisory Council on Poverty emphasized the urgent need for a guaranteed income floor to ensure everyone can live with dignity. Here in Nova Scotia, many people are calling for a basic income. Here in Nova Scotia, 20 municipalities have passed resolutions in support of a basic income. That covers approximately 85% of the population of this province. And I know of 2 more municipalities who are considering such a resolution, and many of them have sent letters to the Premier calling for action in this regard. Nova Scotia community health boards across the province are advocating for a basic income. So when we talk about a basic income, what are we talking about? The definition that is embraced by all advocacy groups across the country is a direct payment from government to ensure that everyone has a sufficient income to meet their basic needs. It would preferably be administered through the CRA. It would be income tested, but it would have no other requirements to obtain the benefit. The maximum benefit would be provided to those who have no income, and that benefit would gradually be reduced as income increases. Those with higher incomes, of course, would not receive a basic income. These are guiding principles that are embraced by advocacy groups across the country, and we hope would be used in developing a basic income. They include one, an essential basic income should be an essential component of a comprehensive safety net, that it should be universally accessible if needed, that it should be unconditional except for income, that it be sufficient to meet basic needs, responsive to changing circumstances, respectful of autonomy, and of course, respectful of Indigenous self-determination. There's been a lot of research that has looked at a guaranteed basic income both in Canada and in other countries, and that research has shown a number of things. One, that it dramatically reduces poverty. Two, that it reduces societal costs. For example, hospital and doctor visits go down, violent crime goes down, that it stimulates local economies, that all work is valued, paid work and unpaid work, that people can take risks, that people have choices, and trust, funnily enough, in government increases with a basic income. Many people feel that people would not work if they had a basic income, but the research shows that's not true. There is a small reduction in paid work hours, but that can be accounted for largely because people go to school or stay in school or take time off to care for family and others. Here's an example, or some examples of what people can do with the basic income, and it's fundamentally transformative, they have found. So I want to now just suggest a few actions that this committee might take before I end my presentation. To learn more about guaranteed basic income. First, I would suggest, or we would suggest, that the committee recommend that an all-party committee be formed to study how a basic income could be implemented here in Nova Scotia. And importantly, the study should include all parties and should look at how it could be implemented in collaboration with the federal government. Secondly, that this committee support and encourage the Nova Scotia government to support the implementation of the PEI project. This is well-formed description of how a basic income could be implemented province-wide. It's feasible, it's affordable, and it could be a first step for implementation across the country. And with that, thank you very much, and I appreciate your time and look forward to our discussion.
Thank you very much. Excuse me, as we enter the question portion of this morning's meeting, I will just remind people to wait till I, as chair, acknowledge you and the red light turns on the mic, just so we can get a nice, clear recording for the record of what is shared this morning. And the first round of questions will begin with the NDP Caucus for 20 minutes. And I would recognize MLA Hamid.
Thank you. Thank you very much for that. That was a lot of really important information in that presentation. I'll start by directing my questions to the department. We're hearing from a lot of Nova Scotians who are forced to make some very difficult decisions, like whether to heat their homes or put food on the table for their kids. And it's clear that life for Nova Scotians is becoming more and more expensive under this government. People aren't getting the support that they need. Nova Scotians work hard and should be able to afford to build their lives here. So how is the department planning to respond to the growing needs of Nova Scotians affording the very basics?
I recognize Deputy Beaton, please.
Yeah, thank you very much. Obviously, you know, affordability is a concern not only in this province but nationally, you know, we have a variety of tools that we use to be able to support people with affordability. Particularly, I think about some of the work that we've done in not only our supportive housing and homelessness areas, but you know, things like diversion funding that are able to provide some immediate support to service providers for those that are facing difficult times. You know, maybe it's supporting them with 1 month's rent to make sure that they're able to stay in their home, as an example. But beyond that, I think I've referenced a few of them in my earlier comments in my opening statement around, you know, we've seen sizable reductions in taxes across the province that definitely will have a benefit. We've indexed income assistance. The $318 disability supplement that was instituted in 2024 was the largest increase in income assistance that we've ever seen. And, you know, from myself personally, I can tell you, you know, in talking to some of our caseworkers, there is one individual that I spoke with who's out of the Guysborough office, who's worked in OSD for over 30 years, and she said it's the single largest impact that she's seen on for her clients in 30 years. So, you know, those things do add up to make a change and to help people. So I think those are some of the areas that we're seeing some positive support.
Thank you. I recognize MLA Hamid.
Thank you very much for that. Yeah, I mean, we do recognize the importance of the heating assistance rebate program as power bills are going up by hundreds of dollars a year since this government came to power. But just last week, we heard that even more people are being overbilled by Nova Scotia Power. Additionally, the heating assistance rebate was cut in September, so 46,000 households are no longer eligible, and the ones that do continue to be eligible, around 70-some thousand households, are receiving $200 less than what they were previously getting. And so, yes, we absolutely see the benefits in those. However, the cuts show that maybe the government does not see the benefit in having those programs in place. And so what are your expectations in terms of how this decision to cut the program will impact, people reaching out to the department for additional supports because they're getting behind on their power bills with Nova Scotia Power?
I recognize Deputy Beaton, please.
Yeah, thanks for the question. I can't actually speak to the heating assistance rebate program. It's not something that falls under opportunities and social development, but I think I would just go back to what I had said earlier around, our diversion support program. I think it's probably important to highlight over the last couple of years, our department has seen significant growth financially in terms of supports to those, not only social assistance, but all other areas. So I can give you a couple of examples. Our employment support and income assistance budget increased by 44% in the last 5 years. Our supportive housing and homelessness budget increased by 1,300%. It was $3 million, it's now $130 million. That's a significant investment, many of which goes directly to service providers to provide diversion supports, which you've outlined. People can go and seek some additional support to make sure that they're able to meet their basic needs. Our disability support budget increased by 66%, and our child and family well-being budget increased by 36%. So I do think that does show that there is a significant commitment to support those that are, vulnerable populations. And, hopefully we'll get an opportunity to talk about some of the other great work that our team is doing as a result of that.
Thank you. I recognize MLA Hamid.
Thank you. So the basic income for a single person without a disability is around $700 and some, but based on the government's requirements for the housing supplement, bachelor unit is $1,202, and so people are purposely being underpaid. And so, again, we recognize the benefits of these programs, but these programs do not go far enough. Diversion funding, for example, I worked in nonprofit before. There were several families that we were working with that were getting around, $6,000 paid a month for an Airbnb rather than just approving them for the rental supplement, which would have been around $1,000 at max. And so we see the benefits of these, but there are holes that are purposely being left there. I will go into another point, though. So in Nova Scotia, food bank use has gone up by 66% since this government was elected in 2021. We also know that, a lot of that, or, the children visiting food banks have also increased. So it's, I don't have the exact number, I thought I did, but child poverty rate is at 14%. Nova Scotia's poverty rate is 12.9. We have some of the highest, or if not the highest, poverty rate in Canada. And tying into that, the government had promised a child and youth advocate in 2021 and introduced legislation to create this office in 2024. Have yet to commit to a timeline, a budget, or advocate appointment. Last month, the government members of this committee voted against our motion to immediately act to create a child and youth advocate in our province, which would be able to make some serious recommendations about how we can reduce child poverty rate and take children out of generational poverty. And so with all of these in mind, provinces that have piloted basic income, people were able to eat more nutritious foods. And we saw one of those papers held up in Basic Income Nova Scotia's presentation. So based on the increasing demand for food banks and other supports, does this department acknowledge that the current programs and supports for Nova Scotians are not keeping up with pace with the rising cost of living?
I recognize Deputy Beaton.
Yeah, thanks. I think I would just go back to what I had said previously in my last answer around the sizable increases that I do think are keeping us at least somewhat at pace with the rising costs of affordability. There's no doubt that affordability is a challenge for all individuals, whether you're a vulnerable, somebody working in a vulnerable situation or not. I would say that. Some of the things that we're doing, we are providing support to, Feed Nova Scotia and the Collaborative Food Networks. As an example, you might have seen the most recent press release last week around government's decision around using some of the alcohol sales to fund increased support for food insecurity, which we think is a positive step. We do know that service providers are faced with increasing costs associated with all elements of affordability. Food is one of those, but that's increased across the country, not just here. You mentioned about the rising number of child poverty, and the data that we have right now does outline a bit of a trend in a positive direction for us. Now, it is very minimal, I will say. However, it does show that we're one of 3 provinces that has trended in a positive direction versus many of the others, from the 2002 MBM data to the 2003. This is the latest data that we've had. So that is a positive signal. And again, it's a retrospect. We're talking about 2023, and I know it's 2025, so we have to take that into context. But with the investments that I think we've seen over the last couple of years, I'm hopeful that trend will continue. But again, it'll depend on how it yields out in the data.
MLA Hamid.
Thank you. I would love to see that data, because the data we're looking at is not showing that. It's showing that poverty rates are increasing, child poverty is increasing. And so if you're able to provide that would be great. You mentioned, you've mentioned the sizable increases in the government's budget, but if we're looking at how people are living, it is not reflecting. And so while, yes, we appreciate that the budget is increasing, real Nova Scotians are not feeling that. They're not getting the benefits of that increase. And so, you had mentioned that the department is not considering looking into a basic income program. So what is preventing the department from even studying the potential of this program?
I recognize Deputy Beaton.
Yeah, thanks. So I think there's a couple of things in terms of, I wouldn't say preventing. I have said that we do look at it. We'll look at all policy options, bring those forward to decision makers. But I think, what we've seen so far to date is that our targeted investments, they probably, in our opinion right now, are as effective as what we would see potentially a guaranteed basic income potentially doing, with keeping costs under a certain level as well. That's one of the things that I think we need to think about. So, the Parliamentary Budget Officer for the federal government did a report recently on guaranteed basic income, and the numbers that they outlined, there's definitions about what you would talk about in terms of a family size and how that would be considered, and I won't go into all the details around that, but when you look at the costs associated with it, it's upwards of potentially $2.5 billion to implement a guaranteed basic income in the way that they would have outlined in that report. The budget for OSD right now is about 1.7. So to put that in context, 2.5 billion would be all of our budget plus, almost the entire budget of seniors and long-term care. So, as policymakers, we do have to think about the financial realities of the province when we bring forward recommendations to government for them to consider, and obviously that will be one of them. When we look at the outcomes associated with our income assistance programs, as well as the stackable options from other departments like rent supplements, et cetera, what we see is that there are, many people that are receiving benefits that are getting close, if not at, almost at the MBM line. Now, we do want to decrease the poverty numbers overall, and we'll continue to look at policy options to do that. But that one of the main reasons that we've sort of held back on looking at a guaranteed basic income is because of the fiscal realities.
I recognize MLA Hamid.
Thank you very much for that. Okay, thank you. I appreciate your answer. So, Deputy Beaton, the last time you were at this committee back in April, you recognized the impact that the federal supports had on child poverty in the early 2020s, which I imagine might be where that data that you're seeing is coming from. However, when those supports ended, child poverty rose again. Nova Scotians have heard for years that this government plans to create a child and youth advocate, but so far there hasn't been any meaningful action to create this position and to have an advocate to speak for our children in this province. And again, this is something that's been introduced, by the NDP in 2018. We're still seeing nothing. The previous minister committed to making sure that this position, this office, has stood up under their watch, but they're no longer the minister, and the office has not been stood up yet. So when will provincial social programs be strengthened so we can actually see an accurate decrease to child poverty in this province?
Deputy Beaton.
So I can tell you that the previous minister was absolutely committed to this, and the current minister is absolutely committed as well. There's work underway. We've engaged with a number of folks in the community and in the sector around their inputs around what the office will look like, and there'll be more to say on that probably in the near future. I'm sorry if I missed the second part of your question there. If you maybe just rephrase that.
MLA Hamid.
The question is, when will provincial social programs be strengthened to see child poverty rates drop again?
Deputy Beaton.
Yeah, thanks. I'm just going to kind of refer back to what I had said earlier. I feel like the department is doing strengthening of programs. We continuously look for improvements, whether it's through feedback loops that we get from our caseworkers on the ground, or whether it's working with service providers about ways that we can strengthen opportunities into community. We're constantly looking at ways to improve, and there's a number of programs that I think we've developed over the last few years that I think have had significant impact in terms of not only addressing some of the needs of those that are in feeling like they're in deep poverty, but also about supporting individuals to try to get closer to the labor market, and happy to talk about those if you like. But
I recognize MLA Hanson.
Thank you, Madam Chair. And just sitting here listening, this is the purpose of the committee, is for us to gather information so that we can do the best work for all Nova Scotians. And it's really interesting that we have a government that talks about solutions and ideas, and that they're listening. And here's a data. There's bills that have been tabled. There's research that could be done. There's studies that could happen. And all it has to do is just implement it in legislature to make sure that we do the right thing and do a study to see what it looks like for Nova Scotians. So we all know that we work for Nova Scotians, and a majority of Nova Scotians disagree with the way that our community OSD system is working right now. So my question is going to be for Ms. Rainingberg. For basic, how would a basic income guarantee help folks who find themselves having to decide between housing, food, or heat?
I recognize Ms. Kay Rainingberg.
Thank you for that question, Susan. MLA Hanson. MLA Hanson is my MLA, so we have spoken before. So I think that that is one of the problems with the current situation today, and people who are struggling because they're living in poverty are having to make those very difficult choices. Do I pay for food and feed my family and put my rent aside for the month and perhaps get evicted from my home because of that? Do I pay rent and not feed my children? These are very difficult decisions, impossible decisions. People should not have to make those decisions. And with a basic income that is at a level that would allow people to meet those basic needs, and that includes food, that includes housing, that includes personal needs that people have. It includes, what am I forgetting?
Well, basically the market basket measure.
The market basket measure. They wouldn't have to, energy, paying for energy, they would not have to make those decisions. Now, I recognize that some people are concerned that if you give a basic income that meets the basic needs, all that will happen is that the cost of those needs will go up. That inflation will increase. I want to say that that has not been found with OASGIS. Inflation did not increase. That was not found with CCB when it was introduced, and when it was increased, inflation was not caused by CCB. It was when we see inflationary increases, it's caused by other factors. Right now, tariffs are causing inflation. But also, you're in government. You can pass legislation that prohibits bad actors from behaving in ways that could inappropriately increase costs as well. So a basic income, as I mentioned before, is one part of a solution. It's not a panacea, but it's a necessary component to adequately support people. I hope I answered your question.
Thank you. I recognize MLA Hansen with 45 seconds.
Okay. Thank you, Madam Chair. So last year, the government said it would help Nova Scotians better afford their bills. The basic income of Nova Scotia has been active since 2015. And in that time, has your group ever been consulted by the government of the day, so members of a party in a position of power to make changes, and whether it was just, have you ever been approached to give information?
Sorry, I recognize Ms. Kay Rainingbird.
Sorry.
Prior to today and the meeting with this committee, we have not been approached officially by the government, but we have spoken with multiple MLAs in our time working and actively seeking a basic income.
That ends this particular segment for the NDP Caucus. We will move on for 10 minutes allotted to the Liberal Caucus, and I would recognize MLA Rankin.
Thank you, Madam Chair, and thanks for being here today on an important topic. I want to approach this from a fiscal responsibility perspective. It's no secret that I believe in balanced budgets and the operating of the government, but I did take some interest in this and looking. What interests me is seeing the high levels of poverty across the province, and you can look at specific communities, and there's huge disparities with some communities, and I won't mention them. I don't want to stigmatize who they are, but I thought of looking at an evidence-based kind of a look at this and the cost. So maybe I'll start with the advocacy group. You mentioned cost of poverty. So I wonder, I think you mentioned the figure of $2 billion, and I wonder how you come up with that figure in terms of homelessness and the healthcare system and the justice system. If you have, is that a good calculation based on the Nova Scotia context, or and can you just explain the cost of not having a program in this, the cost of poverty to taxpayers in Nova Scotia?
Sorry, I recognize your enthusiasm is noted, but again, I would recognize Ms. Kay Rainingbird.
Thank you very much. I appreciate that, and I apologize for speaking out of turn. Yes, well, that's not a figure that we developed ourselves. It's a figure that was developed by CCPA, and they did a very careful study that looked at that, and it included, for example, healthcare costs that go over and above the healthcare costs of people who are not living in poverty, or crime costs that are associated with people who are living in poverty, or intergenerational costs where families cannot struggle their way out of poverty. So they calculated it based upon those sorts of issues and came up with that $2 billion. I wanted to go, you're interested in fiscal responsibility. So if we accept, and I would refer you to the CCPA report because it's very well done. If we accept that there's $2 billion in costs that are incurred in the province as a result of people living in poverty, then we need to consider, well, how much would it cost to get a basic income in Nova Scotia? And the Parliamentary Budget Officer, as was mentioned previously, has done a number of different studies. The most recent study that the Parliamentary Budget Officer did looked at a different sort of definition of family, one in which adult children who were living in the home were counted as part of that family rather than as a separate family. And when you look at that definition of family, the PBO found that the cost of a basic income was reduced by, in his findings, about 50%. The PEI project study also looked at different definitions of family and also found similar results. Their definition of family that included children who lived at home also found that there was a reduction in cost of about 40%. So with that analysis, the cost of a basic income for Nova Scotia was calculated by the PBO, and this is interesting. I don't know if you received this paper, but it was developed by the Yarmouth Community Health Board, and it was sent to the Minister of Opportunities and thank you because she was attending a meeting with other ministers also covering the same mandates. And so they provided very interesting information about the cost and the offsets of a basic income. So the gross cost estimated by the PBO would be $1.55 billion for all of Nova Scotia. But then there are a number of offsets to that cost that could reduce that cost to a net cost that would be far below it. And provinces would need to negotiate with the federal government about what those offsets would need to be. You know, there's a variety of tax credits, for example, that are very small and sometimes temporary that could be rolled into it. Certainly the costs of social assistance could be rolled into it. That's what is being proposed for the PEI project. And that would reduce the gross cost in the PEI project, province-wide implementation of a basic income from $189 million to $125 million, just considering social assistance cost reduction. So when you think about the fiscal responsibility, we have to think about both what poverty is costing us already in this province and how we could reduce that, and also what a basic income would cost and how it could be offset by other, by folding in other expenses.
Thank you. I recognize MLA Rankin with a little over 3 minutes.
Thank you, and I know I'm very limited in time, so I'll just ask my other question to the department. And I'm just wondering, like, there was some kind of an analysis. You mentioned the figure of $2.5 billion in costs, and we have a different figure of maybe $1.55 billion in costs to a program like this. So, like, how in depth did you actually look at, like, the full cost of all the government programs that help support those most vulnerable? Did you look at the administration costs, for example, and the savings you would get from a much more simplified payment that would go out to families?
I recognize Deputy Beaton.
Yeah, thanks very much. I wouldn't suggest that we went into in-depth look at the administration costs of like other programs that would be administered outside of OSD, like the rent supplement as an example, or heating assistance rebate, child care supplements. We didn't go into looking at any great extent on that. A couple of things to mention. I know that that the report that was referenced did outline sort of a minimum value, which has been referenced at 1.5, and it is based on that family composition. And then the other part was 2.5 billion, so it was in that range somewhere. I do think it probably is important for the committee to know when we talk about a guaranteed basic income from the parliamentary budget officer's perspective and what we've looked at. It would really mean basically reducing all of the benefits that we currently provide and having one streamlined process. That requires a bit of a dance partner, which would require the federal government, because a significant number of those investments are actually at the hands of the federal government. So we would have to engage in that conversation with them about whether or not they'd be interested. Our indications from our Atlantic colleagues, particularly in PEI, who have referenced the fact that they would like to push forward on a guaranteed basic income of some sort, is our understanding is that they're not necessarily getting that same level of receptivity from the federal government on the broader piece. Because we're talking about reducing tax credits, we're talking about changing the tax structure. It's a large topic to talk about in terms of how we would reform that. And I think that's been, along with the financial implications, has been one of probably the rate limiting steps for us right now in terms of doing a real deep analysis on it.
I recognize MLA Rankin with 45 seconds.
45 seconds. I guess I'll just say, I don't know if I'll get a question out, but I have noticed anecdotally in my own office over the last number of years the growth of poverty. So we now have like a food pantry set up right outside that is busy. Anytime I'm in there in the evening, it's just a steady stream of people, and then we have to try to fill it the next day. And so we know there's energy poverty issues in this province. We have the food insecurity issue. Love to see the report that there is some kind of progress there, but when you see that some communities are upwards of 40% child poverty, and even some over 50%, like something's not working with our suite of programs, and we need to find a way to assess the effectiveness if despite the growth and supports.
Thank you. That ends this portion of the question period. We will now move to the PC Caucus, who have 30 minutes, and I would recognize MLA Ohit.
Thank you all for being here this morning to have this important discussion. I'm going to start with a question for the deputy. You mentioned a few different things that the department is doing, and you mentioned a toolbox, and you mentioned that one size does not fit all. So I'm wondering if you could just help us understand a little bit in success stories, but also challenges with youth. And when I say in youth, I don't mean just in terms of income, but in providing some structure that help them move forward and join the workforce, et cetera. So can you just for a moment say how you target this sector in your existing programs? Thank you.
I recognize Deputy Beaton.
Yeah, thank you for the question. Unfortunately, the number one indicator of somebody being a recipient of income assistance is whether or not your family's been on income assistance. We also know that the timeline for people that are receiving income assistance is around 6.5 years. So we've had a fairly direct focus on trying to reduce that timeline. but also B, trying to support and break that generational cycle. So we've had big investments in the last number of years around it's called Employment Support Program, so ESS, we typically refer to it, so apologies for the acronyms here, but our ESS programs particularly are supporting youth and those that will be the dependents of those on income assistance. So one particular program we have is called EDGE, and the EDGE program provides wraparound supports for those that are children of dependents or the dependents of those that are on income assistance, to really target them to be able to figure out what are the things that they need to be able to get them closer to the labor market or to actually establish them into the workforce in some meaningful way. That program started in 2021. We did an evaluation in 2024, and 70% of the participants that we had in that program completed the program. And over 40% of those that were in that program found full-time meaningful work, which is a big, the numbers are relatively small, in the couple of hundreds, but I do think that it's a good indicator. So we've provided, a lot of support to our employment support workers to help support these youth, and youth as a focus of those that are the dependents on those receiving income assistance does tend to be a significant focus for us. Employment supports more broadly, I would say, in terms of trying to get people closer to the workforce, because everybody comes from a different perspective. Some may be on income assistance because they found themselves, running out of employment insurance and not able to find a full-time position or a job. Some, there could be life circumstances that happen. They find themselves on income assistance for the first time. Some could be generational. Those that are on generational are likely to have bigger barriers to be able to enter the workforce. They may not have the technical skills. There could be education and training. So we've also worked on a number of programs where we've had with other academic institutions like NSCC to provide bursary programs for those that would either be in care or custody of the minister or potentially recipients of income assistance, to bridge that gap in training to get them closer to the workforce.
I recognize MLA Ohip.
Thank you. There have been a lot of pilot programs done in other jurisdictions with basic income, and in many cases they try to specifically target folks with disabilities, but perhaps keeping them from being in the workforce. And then, of course, youth, and we've touched on that again, but youth coming out of foster care and this sort of thing. Can you tell me a little bit about those? What you've heard about those pilots, but also perhaps what you're doing as an alternative, again, with that one size doesn't fit all. Yeah.
I recognize Deputy Beaton.
Yeah, thanks for the question. You are right. There are a number of provinces that I would say have piloted some form of what they're calling a guaranteed basic income. We know of Newfoundland right now is currently doing one for those age 60 to 64. And we have also, we understand that Quebec also has one. Both of those are programs that we think are more targeted investments. So similar to what you've outlined, in both instances, they are targeted. In the Quebec instance, they already had a program that supported those with disability supports. This is an enhanced program, so anybody that would be qualified for income assistance would be on it that would be under a disability or person living with a disability. And similarly in Newfoundland, we feel that that's very similar to the investment that we've created, which was the $318 disability supplement. It's $300, but it's been indexed. So that it's very similar in that way. The other program that we know PEI has looked at, and they've reached out to us on a number of occasions, is a program called the PATH program. And the PATH program is guaranteed income for any youth that would have had to come into care and custody of the minister for a duration of time. They're now able to get up to 6 years of financial support, which is tailored off up until the age of 25 to recognize the difficulty of not only being a child in care, but also transitioning into adulthood. So the PATH program offers them financial stability. In many ways, it is a guaranteed income for them as they age into 25. But beyond just that, we also have a number of other programs that we would look to support them while they're in the PATH program. One in particular that we're really pleased about is post-care and custody agreements, where we will work with those youth, and we have a number of really great success stories of individuals that are engaging in post-secondary education, whether it's through our college system or the universities, and that tuition and their cost of living is supported as a result of their time with living in care under the minister's custody.
I recognize MLA O'Hit.
Thank you. That's very helpful and very encouraging. And I think MLA Rushton is going to take over.
I recognize MLA Rushton.
Thank you, Madam Chair, and thank you everyone for being here this morning. And I just want to carry on about the conversation about costs and how things would look in Nova Scotia. So I've had many conversations with constituents for and against the idea of a guaranteed basic income. But Deputy, as you've recognized, there would have to be some things that change in the province if you were to go to it. Can you go a little more in depth about that, and just recognizing the fact also that there is a budget line cost to that. When we sit down as budget, you need to know what you're going to be budgeting out for the whole year. There's demands from many departments, but also you've also recognized too that there's other departments that are facing the affordability challenge. With an example you used that's not in your department is the home heating rebate, and there's many others in the department. So I guess would there actually be a savings in the budget line as well, or are we actually taking away from the ones that are at poverty if we were to do one line item versus all the array of programs the government does avail?
I recognize Deputy Beaton.
Thank you. Thank you again for the question. Anybody living in poverty obviously is troubling for us in the department. But you're right. There is, with any policy decision that we would bring forward, we have to weigh a number of items. One is obviously the impact to the targeted group that we're supporting. Broader Nova Scotians is also another. Fiscal responsibility, because we are public stewards of taxpayers' fund money, so we do have to bring those and put a lens on that when we would bring any recommendation forward into government. And the data that we've had so far does outline that the potential impact of moving into a stream where we would have a guaranteed basic income might be too cost prohibitive at this current time. That's one of the lenses that we would apply to it right now. Now, we would need to do a deeper analysis to sort of see what all the ins and the outs are. But, we've looked at a guaranteed basic income in the context of, there's a couple of terminologies, I guess, if I just kind of rewind back. When we talk about guaranteed basic income, you have a guaranteed annual income, which we feel is very similar to our income assistance. And then you have a universal basic income, which under that kind of model, everybody would receive some form of a payment, no matter what their earnings were, and the higher income earners would actually pay that back through taxes. In the Parliamentary Budget Officer's report, one of the areas that we've looked at is certainly by enhancing the guaranteed basic income, you will see that it does lift those that are closer to the poverty line to some great extent. But when we look at those across the spectrum of employment and those wage earners and taxpayers across Nova Scotia, there actually would be a significant strain on a number of other areas in order to cover the costs associated with it, according to his report. So many of the middle class would end up losing money, according to that report, from what our interpretation would be. So those are some of the factors we would weigh as we would bring forward any type of recommendation on how we would look forward on whether a guaranteed basic income would be something we'd want to pursue further.
I recognize MLA Rushton.
Thank you, Madam Chair, and thank you for the answer and the update. I guess in further in my thoughts too, and in conversations, would you be able to give an example of what a monthly or even an annual income would be for a single person or even a family of a couple and one child, or what this may look like for the annual income? I know there was a couple conversations, but I haven't heard a firm number yet.
I recognize Deputy Beaton.
Thank you. So we did do some analysis on this. I'm just seeing if I have it in my notes. I'll try to go off memory here, but you know, when we looked at, because it's one of the things, actually, our new minister has asked us this question a couple of times, so we've tried to pull together some numbers on it. But if you do look across, because one of the things that's not considered in child poverty rates, as an example, are things like school lunch. So those are not categorized in the MBM. And we know that if you're a family that's, you know, using the school lunch program, that's about $1,000 a year that you can say that's going towards. If you're not, I mean, it's a pay-as-you-go system, but that's just an example. So in terms of looking at, you know, a single mother as an example with 2 youth, if I look at the standard household rate for that individual, they'd be roughly around just a little over $1,000 per person. But when you take in some of the other tax incentives that are provided both federally and provincially, like the Canada Child Tax Credit or the Nova Scotia Child Tax Credit, that's about an additional $1,200 a month. And then if you add on a rent supplement, which many of them would be qualified for, and our income assistance caseworkers will be pushing them to try to be able to work through with the Department of Housing. Do you have that there? We'd be looking at roughly, if you add up and you stack all those pieces together, we'd be looking at a total annual income for that individual of roughly around $44,000. And if you add in a few other incentives like our school supply supplement, the GST rebate, Nova Scotia Affordable Tax Credit as an example, you're roughly at about $46,000. Now, I'm not suggesting that that's a huge income, but when we compare it relative to the market basket measure, which is the key measure nationally for poverty, that's 99% of the market basket measure. So when we look at, like, I think that's one of the things that we don't maybe do well is look across government when we're thinking about these programs. But when you think about the stackable aspect that many of these individuals might be able to qualify for, it does get them very, very close, if not at what it would be suggested at a national level of what the market basket measure would be. If I flip that, and because I knew we had done a second one that's very similar to this, but if I looked at a person who's living with a disability and unable to work, and we know that, you know, there's usually an increased cost to care for those individuals, which is why the $300 disability supplement was instituted, and very similar. So if I looked at the stackable levels, the annual assistance for those individuals, if they're able to avail themselves of these, and our caseworkers would work with them on ensuring that they had access to these, they're actually above the MBM at about $113,000. Now, this is just an example. I'm not saying every situation is the same, but, you know, so I guess all that to be said is that, you know, we don't have a targeted basic income. We have income assistance, and we have targeted subsidies that we feel do help us get to a better place when you look at how it impacts on the total market basket measure.
I recognize MLA Rushton.
Thank you, Madam Chair. Thank you for the answer. I share some time with my colleague to the right.
I recognize MLA Fadare.
Thank you, everyone. Thank you for being here. Thank you for the incredible work everyone is doing. So just wanted to be clear, what I hear today seems to hear that we're hearing record high numbers has been invested into ACI budget for 4% increase, 66% increase into disability support program, 1,300% into housing and homeless programs, and 36% into child family well-being budget. I think those are incredible numbers that even we're not where we need to be, but we obviously can see that we're moving in the direction that we need to go. I want to ask the executive lead to please help us define poverty, because there's a lot of definition that's been used around what several ways poverty is being measured. You know, so I want you to be able to speak about. Try to give us a good understanding on, you know, there's what they use the parameters of market basket measure, the LICO, the LMI, and it can be very confusing for a lot of us. So I want you to please explain what these main differences are and how we should use this to interpret those measures when coming to Nova Scotia's data that we're listening to today.
I recognize Mr. Egerton. Recognize Mr. Egerton.
Oh,
there we
sorry.
are.
Thank you for your question. Genuinely, I'm delighted to try and take a stab at this. So, in Canada, there tend to be one of three measures that gets employed, and they're the three you invoke. So LICO is the low-income cutoff, and it really is an old measure that does not tend to get used anymore. It was a measure of whether or not you spent a greater percentage of your income on key essentials, on your basic needs, than the average would be. Honestly, you rarely see LICO nowadays. The two that you will see more often, and it hasn't been updated in a fair amount of time, the two that you'll see most often are LIM, the low-income measure, and MBM, the market basket measure. And I'd say it's quite refreshing that everyone on the panel is referring to the one measure, because I think it is important that when we're talking about these issues, if we start using a load of different data points, a load of different understandings of poverty, we'll never move off a discussion about what the rate is onto what you actually do to combat it. So the market basket measure is it's Canada's official measure of poverty, and what it does is it's administered by the federal government, and they look in, and I forget how many regions there are nationally, but there are 5 within Nova Scotia, and it looks at the cost for a family, and so it looks at various different household compositions to afford your basic needs within a particular geographical area. So it's quite specific. It looks at what the average rent might be for an appropriate number of rooms for your household. It looks at how much clothing is. It looks at transportation costs. And so that would vary in rural areas where it looks at the cost of a modest car and gas compared to, in this case, HRM at least, which would have access to public transit. And then it calculates how much that would cost. And quite simply, if you're above that line, you're not in poverty. And if you're below that line, you are in poverty. We're quite blessed in Canada to have a robust measure of poverty. And it's a good understanding about what poverty actually means. The other one is the low-income measure. I would say that is not a measure of poverty. It's a measure of relative income. So that is the percentage of people that live with less than 50% of the median national income. The problem there is probably pretty obvious straight away. We do not live in a country in which incomes are evenly distributed. So our low-income measure will fluctuate massively, frankly, depending on things like the price of oil in Alberta and the levels of income that come as a result of that. So 3 measures. One has fallen by the wayside. One is really not a measure of poverty. It has some utility if you want to measure between 2 countries where one doesn't have a similar measure of poverty, but really not helpful in a Canadian context. And the other one is the market basket measure, which is a really thorough and robust assessment of what poverty might actually be.
I recognize MLA Fadari.
Thank you for that definition. I think it's very important for us to have an understanding of what that looks like in terms of what poverty looks like. And also we're all using the same terms and we're not out of proportion. I know there's been a lot of debate around, the guaranteed basic income, and we've seen all the provinces try different measures. They've experimented. We've had some cases. I want us to be able to go a bit more into those details, because I know for a place like BC Columbia, for example, they've tried something like this before. I know we talked around estimates from the parliamentary office around how much it will cost Nova Scotia if I know the number is supposed to be around 2.5 billion, even though I think we're within a range based on what Manny tried to explain to us earlier. So I'm just trying to say, from what would we say as a department that we've learned, right, from these other experimented measures that already exist? Because I think sometimes, you don't have to reinvent the wheels. And I know, there's a desire to say, why don't we experiment? What would we say the lessons we've learned from some of these judicial scans that we've done? Because I can see that I think it was something like that. Ontario did one, I can't remember what year it was, where they realized it was difficult for the province to fund. I know we referenced PI, where we had that the federal government probably doesn't have an appetite for it, at least that's the feel we get. So I don't know if the Deputy Minister could speak regarding what have we learned as a department, as government, regarding these other experimental measures that's taking place, not just across Atlantic Canada, but across, Canada as a whole. Thank you.
I recognize Deputy Beaton. I think that was directed at Deputy Beaton? Yes.
Yeah, I think my colleague's going to maybe take this one.
I recognize Mr. Egerton.
Yeah, thanks again for the question. So I'd say first and foremost, the term basic income often gets applied to pilots which are quite different. So I think you invoked Prince Edward Island there, Newfoundland there, Quebec there. I don't see a great difference between what they've done and what Nova Scotia has done in terms of a regular rate for the majority of social assistance applicants or clients, and then an augmented amount for specific demographics. So in the case of Quebec, those who face significant barriers to gaining employment, for example, or in Newfoundland, an age criteria. So they're often termed basic income. If they are basic income, I'd suggest Nova Scotia has a basic income. In the case of, say, the old Manitoba pilot or the more recent Ontario pilot, they are more, I think, akin to where the colleagues across the table here are perhaps getting to, which is a more universal approach. So what are the learnings from those? There are genuinely going to be positives to these types of things. So I think some of them have been mentioned. They offer definite predictability. They offer stability. They are administratively simple. But there are downsides to them that I think we should be able to acknowledge what the positives might be and acknowledge what the things that might be detrimental or things that may need to be overcome. Overwhelmingly, the first one is cost. So that PBO study was 75% of LIM. If you applied that in Nova Scotia according to the study, you would see a 10% diminishment in the rate of poverty. So we'd move from 11.5% to 10.4%. It doesn't, at that rate, does not eradicate poverty. It reduces it. Now, I'm not going to diminish that, but it's not a someone referenced a panacea. It's not a panacea for all issues of social assistance and poverty. But that does come at a significant cost. So it's 1.6 billion depending on one definition and 2.6 billion depending on a different definition of what a family composition is. So it comes at a massive cost. And I appreciate that people talk about like longer term savings on that, but someone would have to consider where that 1.6 or 2.6 billion comes from immediately. And in that report, the mainstay of that would be getting rid of the personal basic exemption at both the provincial and federal levels. That is hundreds of thousands of Nova Scotians who would forego that and pay taxes immediately. Which is obviously would be an important consideration both economically and politically for those who get to decide on these things. The deputy did reference there, the report actually does a good job of dividing between the quintiles. Whichever one you implemented, the 1.6 or the 2.6, it would definitely improve things for the lowest income quintile. Everybody else would pay for it. So when we assess these things, I think sometimes it's seen as like the very wealthiest would pay for it, but in the PBO modelling, it is the, roughly speaking, 80% of Nova Scotians who, because of that tax changes and the ending of those credits, would be called upon to fund this. So it's a balancing act there that people would have to make a determination of. The last thing I would say is there's an estimate in there about the cost of people working or otherwise as a result of that. They call it reduced hours, exiting entirely from employment. Their estimate, and I have to defer to those because these are highly trained economists and I am not, would be about 1.5% of the total. So that's about 129 million or to 140 million of lost labour as a result of implementing what it remains a relatively modest basic income modelled on Ontario's pilot. So I think there are some important lessons to be learned there, and I think ultimately this becomes a very political choice about whether or not the costs and benefits are in favour of a basic income.
I recognize MLA Fadari.
And clearly, it can't be done without the federal government because you need their persuasion, and we also need to have a lot of laws rewritten in order for that to even happen in the first place. But we cited Ontario. One thing was clear. I think they actually abandoned it at some point in time. I think they didn't go forward with the study, if I recall correctly. I just want to quickly ask my last question around disability. People with disability continue to face significant barriers within our society. I think that is clear. We know that that's not new. We know that government has a responsibility of having to help support people with such disability. Can you walk us through, that's DM, through the support the department currently provides for people living with disability specifically, and what impact the remedy work will have as it moves forward? DM.
I recognize Deputy Beaton.
Yeah, thanks very much. The remedy is really transforming the system in terms of how we're going to support persons with disabilities. And there'll be a number of opportunities there for individuals. Currently, we have a number of programs that we provide, whether it's flex and home supports for people to live at home. But we'll be moving towards an independent individualized funding model. And what that will do is provide a certain allotment of funding to those individuals based on the complexity of their needs to be able to utilize for their everyday living, really giving them dignity and independence. The number one piece behind that is choice. They'll be able to choose where it is that they live, but also what they spend their time doing. And individualized funding will really revolutionize the way that persons with disabilities are supported.
I recognize MLA Vadari.
I'll say thank you. I would like to defer to my colleague, Carl.
I recognize MLA Macquarie.
Thank you. Nova Scotia has not traditionally scored well on poverty measures, specifically general poverty rate and child poverty rate. In relation to where we've talked about where those numbers sit now, but how have they changed over the last 5 and 10 years? And are we seeing the impact of the programs that you've described that have recently been implemented? And how do we see them, and what does the future look like with those programs?
Sorry, I recognize Mr. Egerton.
I have to thank you for your question and shout out if I forget the second part of it, because I worry that I'm going to. We haven't. Nova Scotia has not traditionally fared well in either general poverty measures or the child poverty specific measures relative to the rest of Canada. It's probably something that it does not sit well with anyone around this table. It is somewhat a function of Nova Scotia's historical economy, but it does not mean that things cannot be improved. The most recent data for 2023 has Nova Scotia at 11.5% in general poverty rate. That is the 5th highest or lowest, depending on how you want to look at it in a Canadian context. So there are 4 better and 4 worse. In child poverty, again in the 2023 data, Nova Scotia is 4th lowest, so 4th best in child poverty measures. I'd say still stubbornly high, but to the Deputy's point, both have seen a decline since the previous year. How they're going in terms of trends, the child poverty data has come down significantly in 10 years. I'm going to leave aside the CERB, the pandemic.
Sorry to interrupt you, but that ends this particular portion of the questioning. In order to make the most of our time, we're going to divide the remaining time 7-7-14, and I will move to the 7 minutes for the NDP Caucus and recognize MLA Hanson.
Thank you, Madam Chair. And I want to clarify 2 things. When we talk about budget increases to OSC, which is great that there's more funding available, we also have to recognize that the budget went up because of need. that there was a need for these services, and we had to put and invest in these costs for people to be able to have some additional funding in order to survive. And then the other piece that I want to talk about when we talk about funding and being fiduciary, this government spends money like water without oversight. Instead of spending this money on people that need it the most, that are struggling, here we see that, we're talking about dollars for people's lives and their livelihood and their dignity. And then I also want to point out when we mentioned targeted groups and how this will take away from those folks if we, implement or even do a study on how do we pilot something like this. Targeted groups would not be a target anymore because you lift folks out of poverty and you give them that dignified life. So my question is, for OSD, Nova Scotia's total spending on social safety net programs is the lowest per capita in the country. We are one of only 2 provinces without a child and youth advocate to speak for and on behalf of children in our province. Knowing that Nova Scotia has rising food bank use and the highest poverty rate in the country, what is your department doing to make sure Nova Scotians can better afford their bills? Now, I heard there's all these targeted programs that people have to jump through hoops to get to and access, and don't be $2 over the amount that you earn because then you'll be cut off without any question. So I'm wondering, how is the department doing the work to help folks better afford their bills in this upcoming year and forward?
I recognize Deputy Beaton.
Yeah, thanks for the question. I'm not sure about the lowest per capita. I would have to see the numbers on that, so maybe at some other point we can chat about it. I don't know. In terms of supporting individuals, one of the things that we have done is we've increased the earned exemption amount for those that are actually on income assistance to make sure that they're able to work and keep more of their funding. That is one of the primary drivers. We have roughly 37,000 people receiving income assistance. It's about 25,000 households. 15,000 of those households are now receiving the increased disability supplement, which I'll go back to for my earlier comments, which was the largest increase that we've ever seen. And that's not just from my perspective. That's directly from caseworkers that I've talked to in the field talking about how it impacts their clients. These are very, the caseworkers that we have in the department are very empathetic individuals that are trying to work with these people. They see them day in and day out. If you go into a regional office, you can feel it, that they're actually out there trying to support these individuals. So when somebody tells me it's the biggest impact and we can see it, and they're very emotional about the fact that this has happened, I take their word for that. So beyond that, one of the main focuses we've had is about trying to get people back into the workforce, because we know meaningful employment is really important for people's not only mental health but also for helping support them out of poverty. We've seen a 51% increase in those taking up our earned exemption programs, and we've seen a 39% increase in people accepting supports through our employment support program. So, it's not just about the income assistance, it's about the wraparound supports that I think our caseworkers actually provide to be able to support these individuals on a case-by-case basis.
I recognize Emily. Hamid.
Thank you. Before I go into my question, there are just a few things from the previous answers that I would like to highlight. Mentioning that the MBM is the best way to measure poverty, which is great to hear from folks in this office. We would love to see how that actually, how that's taken into consideration when the income assistance rates are so far below that. Talking about supportive housing is only 3.5% of housing in Nova Scotia is actually non-market housing. Okay. And talking about HARP, the rent supplement, and the child care supplement, HARP has been reduced. The rent supplement, we were told by folks in the department, dried up 5 months into the fiscal year. And child care in Nova Scotia, families are paying double what is being paid in comparable provinces. And so while I appreciate the conversation about Ontario, we need to talk about comparable provinces such as other Atlantic provinces. and there was a mention, if I could ask Deputy Beaton to table the calculations that somebody on disability would receive stackable benefits of $113,000, because I'm not sure how they would even be eligible for any supports if you're saying they receive $113,000. And lastly, I just want to say I really appreciate the transparency that this is a political decision, because obviously political will is what's missing here. And empathy doesn't pay bills. So just wanted to put those out there before I get to my question, which is for Basic Income Nova Scotia. Manitoba tested a basic income program back in the 1970s that was designed to supplement the incomes of working people who were struggling to keep up with the cost of living. And the former minister of this department had famously said that the best social program is a job. Would you expect to see working Nova Scotians benefiting from basic income if it was implemented in our province? And what do you think about the previous minister's suggestion that the best social support is a job?
I recognize Ms. Kay Rainingbird with 40 seconds.
40 seconds. Yeah, not all people have opportunities, job opportunities, and so not everybody can get a job. Would people who work benefit from a basic income? Absolutely. It's all in the design of a basic income, and if you reduce the benefit in a manner that well, typically you reduce the benefit in pilots by 50%, and what that means is that people will always benefit from working. I'm
sorry to interrupt you, but that ends that segment. As somebody who's had to answer in question period in 45 seconds, I feel for the task that was thrown at you. But we will move to MLA Rankin.
Thank you, Madam Chair. And as I was saying last time, we're seeing growth in supports. I don't think anyone's questioning that, but there doesn't seem to be that corresponding decrease in the metrics around the poverty rates, food insecurity. We still have some of the highest rents in the province, in the country, and certainly in Halifax. So we got all these programs that are supposed to help, and they fall into different departments. So we have the Growth and Development Department spending $75 million on rent supplements, and then we have the Heating Assistance Rebate Program, another $77 million in another department. But who in government's actually assessing these programs to make sure that they help? And there's examples of working people, cashier at a store in Timberley makes minimum wage, works full-time, and is not able to access the Heating Assistance Rebate Program. Like, how does that happen? Where we are removing 40-some thousand people that are trying to get by from the supports they need to pay their power bill. And I just find it interesting, to say the least, that your department that's tasked with helping people don't have their hands on making sure that these programs are keeping up, to make sure that we're putting a dent in the problem that we're seeing in front of us. So, which department is really looking at these programs? Because a decision was made to cut that program, and there's a lot of people suffering, I think, from that. So does your department have a handle on the effectiveness of these programs?
I recognize Deputy Beaton.
Yeah, thanks very much. So I can speak for the programs that we offer at Opportunities in Social Development. We do evaluations on our programs periodically. We have an evaluation team that does that work, and where and when we see gaps or limitations, we work to try to close those. So, we're always looking at our programs from an outcomes perspective in terms of how are they meeting the best outcomes that were previously designed, and we'll make recommendations or changes potentially to those programs. In terms of I'll go back on the Heating Assistance Rebate Program that you've talked about. Again, not our department, and I don't want to just pass the buck on that one, but it's not something that we would have any control over because we don't actually administer the program. We do know that there are clients of ours that would be on income assistance that would probably avail themselves of some of those programs. But in terms of the broader context of evaluating all of the government programs, those are done individually at the department level.
I recognize MLA Rankin.
Yeah, and I guess the comment to that is there should be someone in government that has a true picture of assessing the problem, so it's not segmented in different, we do this for economic development. If it's a priority, or healthcare, there's a table of deputies that looks at programs. But I just don't see any program evaluation at all during the tenure of this government, whether it's trying to address poverty or other big problems. And one other thing that stood out to me is the mention of the generational trend and families that are on social assistance, that their children end up on social assistance. And so what are we doing about that? Some of the communities that I referenced that have, the average you said is 11.5%, but we have communities that over generations are at like 50%. So something is not working here. And what are we going to do about this severe and persistent problem in families, not because of anything they did, but in fact the institutions that have failed them, the government of Nova Scotia. So what are we going to do to address these pockets of our fellow Nova Scotians, these communities that just can't get out of this cycle? What is the department doing about that?
I recognize Deputy Beaton.
Thank you. I might take that in 2 points. I would say that from an evaluation perspective, certainly at OSD, we are doing that work. And I would highlight back to the increases that we've seen. Those increases, obviously, there's, a budgetary process. You'd be familiar with how that works. There's requests into government for additional support based on the analysis that we would have coming from not only our individual policy shop work, but also, feedback from clients and also from service providers. And, I do think that as part of that work that we've done and the evaluation, what you've seen is translated into increased investments in a variety of areas, and therefore increased impact in the community. So, a reference was made earlier around supportive housing, and the need was obviously there, and therefore we had to put it out there to sort of figure out how we were going to do this. But 172% increase in supportive housing numbers since 2020. Like, that is a staggering number. Now, I recognize that it's not a huge number of market housing, but if we didn't have that, where would we be? So I do think that these investments do matter. We can always do more, but it is a balance between trying to balance all of the inputs and the initiatives across government. But 585 new emergency shelter beds established in that same time period. Like, these are significant investments that do have an impact on trying to get people that are facing hard realities and vulnerable situations into a better place. So, those are some of the things, some of the metrics that we would look at. We have an outcomes process within our department, so we have what we call outcome measures that we manage each of our core areas around. One of those is around reducing the time that people are on income assistance. So it's just recently been established. That 6.4 years is obviously really concerning to us. We want to try to break that generational cycle, which is why we've instituted programs like directly supporting youth of those that are on income assistance. And we've seen some really remarkable case studies. I mean, I could talk to you about anecdotes and maybe just one just to leave the committee with what, a woman who was on income assistance for predominantly her whole life. Both her sons got on the EDGE program, and they inspired her to actually go through the ESS program, and now she's working part-time as well. So like that is part of that change on breaking the generational cycle, and it takes time, for sure.
Thank you, Emily Rankin. Second, sorry, I guess. We will move on to the final question allotment, 14 minutes. And I would recognize MLA Macquarie.
Thank you, and maybe I'll give Mr. Egerton a chance to answer the question that he was in the middle of when time ran out before, just about the changes in the rates and the impact that the department's programs have had.
Thank you for the question. People may live to regret giving me a second chance to speak, but I'll do my best. So we referenced the data point. I'd say forget exactly where it was, but child poverty data has, the rate of child poverty declined significantly over a 10-year period. From, I don't have it exactly in front of me, from something, I'm on the wrong one. Somewhere close to 20% to around 11, 12% now. The general poverty rate has remained, it has decreased over that time, but is, I concede, stubbornly high. And I think I referenced we're fifth in the general poverty rates and fourth lowest in the child poverty rates for 2023. Our department plays a significant role in that diminishment and in taking on the issue of poverty. We oversee some of the key levers. Income assistance has been mentioned. I think the Nova Scotia Child Benefit is, along with its federal counterpart, is key in addressing child poverty. But I'd also stress that others play a role in this. It is across, and to the MLA's point, it is across things like financial transfers, economic development writ large, immigration, access to education, minimum wage. All these things combined play roles in reducing and combating the rates of both poverty and child poverty. As I recall, there was a question about where this might go in the future. I would hesitate to predict or forecast where poverty rates will go. I feel like I will be reminded of whatever forecasting I made when I'm inevitably wrong. But I will say that the Deputy has spoken to our staff in OSD. The overwhelming number of our clients and participants are low income, almost all of them. And you don't go and work in OSD unless you are, this is paramount to you and it's something that you take seriously and you live and breathe, and you really want to try and reduce the numbers who are living in poverty and increase the numbers who can meet their basic needs. So I won't predict a rate, but I will suggest that we will continue to work very hard to make sure that more Nova Scotians are able to meet their basic needs, and not to discount the adults, but with a particular focus on the children, the youth there, because really the key to this is going to be how do you break intergenerational poverty, and it starts by reducing the number of children who live in poverty.
Thank you. I recognize MLA Rushton.
Thank you, Madam Chair, and thank you to the guests. I've heard a couple comments about whether a program would disincentivize productivity and workforce, and in the end, the productivity of the province. I've also heard a couple comments about the need for good jobs for Nova Scotians. So I guess I have a two-part question, and I'd like to follow up with the department on any stats that you may have on this. As we know, during the federal pandemic, the Auditor General has actually come out and said that it actually disincentivized the work. That's what it was created for obvious reasons during that. But with the province, that automation isn't a significant factor in our workforce. Would the department look at this as being a disincentivized process for our workforce, and in the end being a disincentivization for the productivity? I've heard you say some numbers, but I didn't quite hear what the high numbers were, or the actual numbers were on that.
I recognize Mr. Egerton.
Thank you for the question. Can I just clarify, is it in terms of automation or in terms of the responses to the pandemic and a basic income? That the latter?
Sorry, Mr. Egerton, are you clear on the question?
I think so.
Okay.
If not, you can feel free to
I
correct me. I'm not.
recognize Mr. Egerton.
Okay. So having just said not great at forecasting, I'd say where automation may go, a similar reservation about forecasting the impact of that. I would say that we work very closely on labour trends with our friends from Department of Finance and LSI in particular. It is clearly going to be a disruptive force. The extent to which it will, the exact jobs that will be changed as a result of automation is very hard to predict. I think the best thing we can do is twofold, is to work with data analysts and economists as we do from other departments to help guide us in terms of what the trends going forward might be. And the second thing is we have a cohort of 25,000 ESIA cases. That includes far more than 25,000 people. One of the foremost jobs there is just to support those individuals to develop the skills, the experiences, the qualifications that will be needed that allows them to withstand changes in the economy such as automation going forward. So it really is a laser focus, maybe a little strong, but a real focus on providing and supporting those clients in gaining the skills and experiences required to compete and participate in whatever the economy is in the future.
I recognize MLA Rushton.
Thank you, thank you. Automation was a little secondary to it, but yeah, no, it was just the idea of the program. Would it disincentivize the productivity of the province, productivity of the workforce? And I know you shared some numbers earlier, and I'm recognizing some time. I think my colleagues have some other questions. I'll just follow up with that. We've heard talking about jobs today, and I've been involved with the industry where automation did take place. In actual fact, we didn't lose workforce. We actually enhanced the jobs that the workforce was able to do, and the productivity went up and created more jobs, and actually more people came into the industry that I was involved with. So it was a win-win situation. But the secondary follow-up to that question, would it be fair to say that the focus that we've been on as a government across all departments, where affordability is key in mind for every department, we have programs in different departments, would it be fair to say that our focus right now should be on growing the economy, growing the productivity of the province, and creating more good-paying jobs for all Nova Scotians, and maintain and always looking at the programs that we do avail through every department, and focus on growing the economy so those good-paying jobs are available to everyone, whether it's automation or different technologies that come to play.
I recognize Deputy Beaton.
Yeah, thanks for the question. I think, in terms of the work that we're doing at the department, in terms of growing the workforce, particularly those that are on income assistance, we see huge opportunities there. We know there's demand. Now, not every individual is going to be able to work. We know some have, are on disability support for a reason, but that doesn't mean that there's not an opportunity to think differently about how they might be able to contribute. So, things like increasing the earned exemption have been a big benefit. And it's obvious in terms of the enrollment and the increase in people taking that up that there is a desire for people want to be able to participate in the workforce. People don't find themselves on income assistance because they want to be there. It's a difficult place to be when you're struggling to make ends meet, and our focus on increasing employment supports and working with departments like labor skills and immigration around, are there ways that we can think differently about supporting those on income assistance through things like apprenticeship, as an example, and direct entry programs into the workforce. Those are all areas that I think we want to move in, and places that we're having conversations right now with our colleagues. So I think it is fair to say that a focus on growing the economy obviously is key. It was referenced earlier about significant poverty rates in various parts of the province. A lot of that does revolve around economic disparity in those communities, and providing social supports is not going to be the avenue to be able to grow those communities. It's going to have to be done through other government responses, and growing the economy in those areas is certainly a key feature of that.
I recognize MLA Ohid with roughly 4 minutes.
4 minutes, okay. Thank you, Chair, and thank you again, folks. I love hearing about change, and I love hearing about how we adapt to feedback that we receive. So everybody around this table receives feedback from recipients, and that feedback is passed on to your departments. And I'd just like to hear a little bit about what you've done lately to change how you deliver services.
I recognize Deputy Beaton.
Yeah, thanks very much. We get feedback from clients, from service providers frequently, and we do try to adapt to make changes within our processes. A couple of examples I think I could lean on recently. One is we have a special needs program as part of our income assistance, which can qualify for things like healthcare payments. It could be a variety of different things. There's over 50 different things that could be potentially marked under that, and it can be administratively burdensome, as you can imagine, in terms of the back and forth. Receipts have to be received, have to be submitted for proof of purchase, all of those things. And in the last month, we made some changes based on feedback we had from our caseworkers, but also from recipients of removing the need for receipts for special need payments for those things under $200, as an example. Some of it is it helps with administratively, but also it can be burdensome for some clients, and also many of them face stigma for some of the needs that they'd be asking for. Another one was a permanent change that we made just this year. In the last 2 years, we recognized the increased costs associated with families and bringing their children back into school and the cost of school supplies. We had previously done a 25% increase on the special payments for school supplies, and we changed that in 2025 for a permanent increase of over $100. Well, depending on the age, there's levels, but I think it's $100 up to $200 based on the age of the individual child and what school they're attending. That was another one. Another one would be so the land titles that's currently happening as part of our Afrocentric review that was done across our ESIA programs. Many of those historical communities have not had land titles, or they're currently undergoing that, and recognize that they may not have the title at this point, but if they are receiving income assistance, sometimes they're eligible for, or they can be assessed for supports around things that might be in arrears or property taxes, et cetera. To be able to assess those, typically you have to have a land title. So as a result of this process, what we've done is to sort of say to any of those historically, those communities that are currently going through the land titles process, is we will exempt those from that, assuming that the land title is there to be able to facilitate that change quicker.
I recognize MLA Ohit with 1 minute.
Can we give my time to our witnesses to make some final comments?
We can certainly move on. I think that's fair and appropriate to give our witnesses today that opportunity. Deputy Beaton may need a drink of water, so perhaps if the folks from Big Nova Scotia, Ms. Kay Rainingbird, would you like to make some closing comments?
Okay. Yes, I would. Thank you. I'm ready. Yes. Thank you very much. Yeah, I found this an interesting meeting. I wanted to bring forward a number of issues that were touched upon today and haven't really been talked about in some detail. One of them is this. In Canada, we have targeted basic income programs already. We have OAS, GIS, and that's for people 65 years and up. When OAS, GIS, when the two of them were implemented, the rate of poverty dropped dramatically for people who are that age. It went from being the highest of age groups to the lowest of age groups. Now OAS GIS isn't necessarily keeping up with inflation, but and that's a problem. But it remains that population is supported in ways that younger adults are not supported. The people who have been left out are adults who are 18 to 64 years of age. And that tends to be the focus of basic income programs. Another targeted basic income program that's been implemented, and this goes back to your comment about what are we talking about when we talk about a basic income. So this wouldn't be a full basic income program, but the CCB is also a program that targets particular individuals, provides income support through their families for children, and in so doing, the research has shown that the poverty rates for children have dropped because the families are recipients of that income assistance program. Now, the primary income assistance that's received, even though there's been some provided by the provinces through the federal government. And so when you look at the drop in poverty rates in children, it's because of the CCB at the federal level to a very large extent. And I think that needs to be said. CERB, during the pandemic, was a targeted basic income program for people who lost income in work. And research showed that when they received CERB, many of those people used that time and the money, because they were being paid to stay home, if you recall. They used that time and that money to increase their skill level. So a very large number of those people exited the CERB program and were able to secure better jobs as a result of it. So these are the sorts of things that have been done by the federal government and have supported workers. I think when we talk about a basic income, and there's been a little bit of discussion around this today, the devil really is in the details. The devil is in the details, and that's why it's so important that if Nova Scotia wants to explore this issue, that they need to explore it in cooperation with the federal government, and that's what the PEI province, or with the assumption that a basic income would be implemented in cooperation with the federal government, and that is exactly what the PEI government is trying to do, is engage the federal government to implement the basic income as they've defined it, to study the impacts, to modify it. Because one of the really interesting things about the research that they're proposing is that they would look at the administration of that program and modify it to make it better as they went along. That's why I think Nova Scotia raising its voice to support the PEI project would be important, especially at this time, as you said. There have been some comments that this is not something that the federal government is interested in doing with the provincial government. So if provinces demand it, it can take place. It can't be done by provinces alone. Absolutely, it can't be done by provinces alone. You're struggling to try to deal with an issue that is broader than just a provincial budget can deal with. So I just wanted to bring that forward. There was a comment made that the middle class would pay for it. Well, that is a political decision, isn't it? I mean, if you change the taxation system to make the middle class pay for it, the middle class will pay for it. But if you change the taxation system in ways that make the people who can pay more, and unfortunately I've seen the opposite happening recently in terms of taxation, then the principle that should be embraced in any definition and any delineation of a basic income program, that no one would be worse off because of the basic income, could be insured. So I think that I will stop with those comments. I wanted to just note that, as I mentioned in my presentation, quite a number of municipalities have passed resolutions in support of a basic income, and the first one was was Halifax. The first one was Halifax, but Cumberland County has passed resolutions as well in support of Cumberland County Municipality has passed a resolution in support. Amherst has passed a resolution in support. So around this table, your constituents are calling for your help in making their lives more affordable. And I think it's really incumbent upon you to consider a basic income and very carefully and think about how that might help your constituents in this province. So thank you very much for having us. Pierre, did you have any further? Do you mind if I ask?
Mr. Stevens, I would recognize Mr. Stevens.
Yeah, thank you. I just wanted to add something that worried me a bit about listening to the conversation. And there was a lot of talk about fiscal responsibility. But I haven't heard anything about what is the cost to the individual who lives in poverty. 100 people per day die prematurely in Canada because they live in poverty. 100 people a day. Their lifespan gets cut by 10 to 15 years because they live in poverty. And we don't even mention that as a cost. So where's our fiscal responsibility? Dennis Raphael has written extensively about this, over 300 articles and many books. And he talks his income assistance programs that we have in Canada, he calls that social murder. That's just my comment.
I want to give the opportunity, thank you. I want to give an opportunity to Deputy Beaton to make closing comments.
Yeah, thank you very much for the opportunity to be here today. You know, I'd be remiss if I didn't just make a comment about our team. I know we've talked a little bit about some of the work that we've done as a department, and Frazer and I get to be here today and talk about some of those highlights. And as I said, we can always do more, and we reflect and we look at that as a department. But we have 1,700 people that work at Department of OSD across in every corner of this province, and they're meeting with people directly. Some of them who are in the most difficult situations of their lives, and they do it with empathy, and they do it with compassion. And they use the tools that they have in their toolbox to be able to bring opportunities forward to help lift them where and when they can. You know, we didn't get to highlight, you know, a lot of success stories here today just based on the time, but I can tell you the work of the department is quite remarkable. I've been there for 18 months, and every day I'm inspired by the work that these people do on the front lines. So I think it's, you know, we're here talking about models for delivery and how there's failures in certain areas and how potentially some might be perceived as better. But under the current system that we have, the people that work at OSD are every day in and day out trying to support individuals on the front lines. And I think I just wanted to make sure I said a huge thank you from my perspective on that. And I'm sure it's meaningful and purposeful work that they do every single day. So thank you.
Thank you, and I think I can speak for the table in extending thank you to all those on particularly the front lines. Certainly a thank you to our witnesses here today. Normally we might take a recess, but we are approaching the magic hour, and there are a few items that we have to quickly deal with. So I will excuse our witnesses as we move on quickly. And being mindful of the time, there are a number of pieces of correspondence, notably that Associate Deputy Minister Nicole Johnson-Morrison did respond to the request for information. Is there any further discussion on those materials? If not, moving on, there were a number of letters as well that are listed in the agenda that were received from various organizations and agencies on the topic of today's discussion. Is there any discussion relevant to those letters. Okay. The next community services meeting will be an agenda-setting meeting. As I understand, we are fresh out of our prior list of topics. So we do ask parties to submit proposed topics by Monday, December 20th. The other question is, I know that some people will travel to be with family and friends over the holiday period. We would be scheduled to meet on Tuesday, January 6th. I was asked to raise whether the 6th, whether we wish to move ahead with the 6th, or whether there was any interest in delaying potentially to Thursday, January 8th. Seems we're fine with the 6th. No, okay. And so we will rise to meet again on January 6th for an agenda-setting meeting. This meeting is adjourned.